All right. All right. I'm Gavin, Baker Labs, and we have here today with Paul Sponcia, who's the CEO of the IT company, who has an exceptional reputation of doing just great work in the IT space, but also thinking deeply about how IT and technology impacts and our work, our lives, and because we touch it every day, right? So, Paul, thanks for being here with us today, working with me and everyone who's watching. So,
yeah.
And we're going to specifically talk about basically the future of work as it relates to technology. But Paul and I both own businesses that operate with inside the healthcare space, right? We work with practices and other businesses inside healthcare. And so we're going to talk about that, how that's uniquely different. And really the answer to that, telemedicine, but how do you implement that? What do people think about that? Those kinds of questions. So let's go ahead and jump in. I'm gonna grab my notes here. When a business is being impacted like we are in this crisis, what are some of the main questions you guys are getting, both either from healthcare practices or just general businesses you work with, to say, how do we get to our employees to still have access to all the stuff that we need and continue operations because their clients and their customers are still working?
Yeah, I think, probably two different categories. Healthcare and the general businesses are a little different. I think primarily because healthcare, from a clinical perspective, it's difficult to have one of the challenges of work from home.
There it is. It's perfect. Right.
So, yeah, there you go. I have a 19-month-old, and she is wide open. So yeah, there you have it. Exactly what it's like to work from home.
Exactly.
So, but anyhow, so with a clinical setting where there, typically physicians would have some sort of team, MAs, PAs, the physician, nurses, different people that are all taking you and doing different things. And so it's difficult to fully replicate that, in a virtual setting and figure out the pieces part. So, physicians' practices have thought a lot about when they're not in an essential they're not essential, meaning that they're not on the front lines as a hospital or something. They've got staff furloughs to think about. They have all these components because they went from seeing, 50 patients per day per physician to 2, or 3 or whatever. And so they have all this staff, all these people, all this stuff. So they haven't really asked us as much about how to work from home because what do they do? They have nothing to do to work from home, They have obviously talked to us about telemedicine, and we helped a lot in just helping them vet some of those ideas and answers because the HHS and CMS put some new rules out that said, hey, in this time you can use Skype and Teams and FaceTime. And all these other components. And so we worked through that because even with FaceTime, do we give, then all of a sudden they have the doctor's email or phone number. So do we set up, kind of vanity emails? And so we worked through a lot of that stuff. And then also there's a lot of great telemedicine platforms that we helped customers sort of work through and answer questions about. On the business side, it was just completely different, where, businesses could take their infrastructure from their people, meaning infrastructure, and just send them home and do the same work. Those questions were largely around not around the back-end technology because all that stuff was in place. Our customers, it was more about, well, we didn't anticipate working from home, so I don't have a laptop. I don't have a camera. I don't have a space to work in, at my house. So we were dealing with a lot of that stuff. Like, do we allow people to take their desktop computers to their house? Do we allow them to actually use their home computer that's completely not a part of the secured network? Do we do a VPN? Do we do some other fashion? So those are a lot of the things that we dealt with, were not as much about the back end, but more about like this device, like what am I going to use to connect and where am I going to sit? And that's the majority of it.
Well, that's good. Well, I think even just what you mentioned on like FaceTime and then they have access to this information, that's really helpful because I think a lot of, honestly, I wouldn't have thought of that. I would not have thought about, okay, I'm revealing this information inadvertently, right? Desire to serve a patient. Great, let's get on FaceTime. I hadn't thought about, okay, well then, now they have access to all this stuff. And what if they FaceTime me in 3 months and I don't want to get a FaceTime.
Well,
how's that all work?
And your Apple device isn't set up to have. You can actually tell it that you have multiple email addresses, but you have to go in and say, this is my primary one for now. So now that I'm doing telemedicine, I need to make this fake one my primary one so that that's what they see. And it's just too hard. It was too complicated to make all that stuff work. So some of the telemed.
So what were the practical steps? Yes, so what are the practical steps that you actually then help them implement or think through?
Yeah, a lot of it is we just directed them towards some of the resources we were familiar with around telemedicine. I wish I should have looked those back up. I don't remember. There's 2 of them that are out there that are free and very good at what they do. And then a couple of them had their EHR platforms already had some functionality, like, and this wasn't their EHR platform, but they were already using a particular EHR that worked with a product called DocT, and DocT already had a telemed kind of product that you could use. So we really, I wouldn't say we were super integrated as much as we were peripherally, like, asking questions, listening, and making suggestions. And we tried to help several of them through the FaceTime issue. And that's when we were like, hey, it's really just complicated. If you're okay with the customer just seeing your information, or maybe you set up a fake iPad, and do it that way, or use an iPad that's not attached to your current stuff. So the main thing was just first off asking the EHR vendor, do you have one? Because if it's integrated, that's great. It's just less work for them to do. So that was kind of step number 1. Step number 2 is if there wasn't something, were there any of the other apps you're using, like DocT as an example, not their EHR, but a separate thing that may have it. And then the third would be dropping back to some of these applications that exist out there, some of the free ones or the paid. And we did a healthcare roundtable interview that I think is maybe going live tomorrow with 6 or 7 of our practices where they talked about that stuff. So there's some content in there about that.
Okay. We'll look for that. Yeah, DocT.me is one that we use.
Yes, that is
our doc. The website's DocT.me, and that's one that we've recommended because it does have a free tier, right?
That's the one.
Yeah. And just like any free software, right? It goes up and how many people are on it? Do you want to charge people a copay beforehand? But at its core basis, it's a HIPAA compliant.
That's great. Yeah.
Yeah, as long as it integrates with your, and it has a great scheduling tool. It's got some great pieces, even outside of this crisis. We've had some folks that we worked with or talked with that have used it because it provides the convenience of scheduling that patients want.
I think the output of a lot of this, or maybe on the backside of a lot of this, hopefully, now these practices have some experience with it, they're not as reluctant to it. Yeah. And hopefully they will reevaluate and see that maybe this is a means to increase patient satisfaction and to speed up some of the simple things that people maybe have challenges with. And so I hope that that's a byproduct, hopefully.
I hope so too. One of our clients actually said that. They're closed, their medical office, and he just said, I want to use this time to be thinking about stuff where we can get better. He's like, so let's think about telemedicine. There's probably ways that we could be using it that we've never thought about, but someone's coming in for a, final checkup, or, he has applications where they don't really need to be occupying a whole room in their building, right?
Yeah.
It's a 10-minute thing. They don't need it. They could be sitting right here in this chair, right? There's no medical really technology being implemented. It's really just kind of a checkup. And it needs a doctor, but it doesn't necessarily need the room. And the room is pretty expensive, right? Full equipment and all kinds of pieces. And so, and you and I were talking before about kind of just the impact of telemedicine. And you found an interesting stat. I think it was 53% of people had left a doctor's appointment prior to it starting because it took too long, way too long.
Yeah. Have you ever done that?
And I think, have I ever left a doctor's appointment?
Yeah.
I have not, but I don't go to the doctor very often, so I'm not a good use case for that. So,
I've done it. I don't go a lot either, but I've been in that situation where I've been like, I gotta go. Like, I can't just hang around here for the next 3 hours waiting for this thing.
Now I have left. I was talking earlier. I have left not in the middle of one, but like at the end of an appointment that is just, we're waiting for them to come back, and it's been, longer than I really felt was expected. 15 minutes, and it's like, okay, let me go find somebody because I got to get to a meeting, right?
Yeah.
You and I both live pretty scheduled lives, and so, and I think that's the hard part about that. The healthcare community sometimes gets lost in a little bit with patients is they tend to, that's where people get feedback. I mean, even in online reviews, the feedback is never about the actual care they receive. It's always about how they're treated, whether that's billing or the front desk person was rude or the nurse was rude. I mean, it's never, or the doctor was rude or they took too long. It's that kind of stuff. And so I think that's where, one of the things that we see with our clients and think a lot about is patient, what's happening with patients, right? And so one of the things that is going to follow is as patients, healthcare gets consumerized, right? We become buyers instead of patients. We're going to start to ask harder questions. We're going to go to places that naturally kind of value us. And so if one of our clients, he's a younger doctor, and his whole thing is like, if your appointment's at 10, it starts at 10, right? That's his thing, because he wants people to know he respects their time, so he doesn't double book appointments because he understands. I will send you his name, because he just recognizes it is.
Yeah.
Well, just like, I wouldn't want to be treated that way.
Just recognizing it is actually a big deal. I mean, on that, 53% said they left, 23% said they actually delayed going to the doctor because it takes too long, and 13% delayed a visit because they're just too busy, knowing that my busyness isn't going to mesh with the fact that I have to wait around. There's actually, just if you want to have some fun, but it's real, go watch the Seinfeld episode about going to the doctor. If you haven't seen that one, go watch it. Like, you'll be in stitches laughing about it because it's so true. He's like, you're in the waiting room, and then you go to the other waiting room, and then you finally go to the room, and you have to wait there. Like, it's just this but it's like, it's exactly the true thing of like, why am I doing this thing where telemedicine, I think, and there's reasons why, we have a lot of physicians, both of us know that there are just, some of it's the system, some of it's just the way they get paid, and they're trying to manage all these different, a lot of grace for what they're having to go through as well. 100%. So it's not all, they're just trying to figure out how to run their business the best they can and keep the doors open because it keeps getting, more expensive. But telemedicine has the opportunity to, I think, in some of this stuff, kind of knock that out fast. My son just had a virtual like orthodontist follow-up, and things like that, those are great ways to do. Follow-ups are probably one of the best ways to do telemedicine, where you had a cold and you just, or you had a bacterial infection and you had medicine and you need to do a follow-up for 15 minutes. Yep. I'm not coughing. I'm not sniffling. I'm good. No fever. Yep. Great. Check off, move on. So.
Yeah, 100%. Well, I think like you just said, it's a good point. I mean, I think, when we talk with folks about their doctor's visits a lot, and one of the things we talk about is just, hey, doctors they're in a weird spot. I mean, they got into medicine. They made the decision 20, 30 years ago in some cases because they wanted to help people. They had an interest in that, and they kind of are now in a system where, they sometimes I'll go meet a doctor for lunch, and he'll say, hey, great, let me know beforehand, just make sure my schedule's good. And I'll say, hey, great, I've got, I've had a reply and say, great, I'll be there in half an hour. I've only got to see 5 more patients. You're like, how in the world? You got to see 5 patients, get in your car and drive to lunch. Right? I mean, so it's not, and so they're under just such a, like you talked about, billing pressure, insurance question. I mean, there's all these things that are required for them to have to do it. And so telemedicine does offer some conveniences for both sides, maybe, where the visit could go faster and all that. And, we brainstormed yesterday as a team about our practices that we work with. And one of the questions we had too was like, are people, I mean, just as a reaction to kind of this invisible disease around us, are people going to be less likely to go to the doctor because they don't want to wait in a waiting room and maybe pick up some kind of thing that they don't want?
Could it change the way, like, my wife took our son to his like second care visit or whatever after he was born, and wait in the car, we'll text you when we're ready, we'll bring you in the back door, like, is the whole medical thing going to change? Which, I mean, frankly, if you had a simple office that you didn't have to go up flights of stairs and stuff, I wouldn't care to wait in my car in the air condition, listen to some music, and call me and I'll walk in then. As long as when I walk in, that's the key. You're going to see me. It's not going to be me sitting in there waiting on somebody. So, which again, is the value of telemed is, like you said, you're waiting, you get a text, you jump in, move, you move on. So
Right.
Good idea.
But Paul, thanks for being with us today. If you guys have questions about your marketing or what you're doing or how to grow in these times, please reach out to me. Or if there's people you want to talk to or see, I'm happy to reach out to them, and we can get them on video here too. But Paul, thanks so much for your time and doing this. So me too.
Yeah.
So stay safe, and we'll see you soon.
All right, man. Take care.